Okay, we are back. This is Senate Health and Welfare, and we're just finishing up our work for the day. It is still February 11th. Hard to believe. So we've been taking a lot of testimony on S 194, 195, and 197. And when we started taking testimony on these bills, we thought it might be useful to combine a couple of them. And so committee, I think our discussion right now, we're just going to talk for the next, 10 minutes or so and then take a break before we have to go on the floor. But I just would like to say up front that I think 197 could take a turn toward youth, and perhaps there's a way we can change the language in that bill. And as I mentioned earlier, I will be working with folks in the education committee and on this and with Katie. So I think why don't we keep that bill separate for now? And then the conversation is, do we want to combine 194 and 195 or keep them separate? So I'm open. Let's just open up a discussion how you want to proceed on that.
Well,
Go
Madam
ahead.
Chair, if I could, I think, 194 and 195 are complementary bills. To establish peer respite centers would require a workforce, and to certify peer support specialists would certainly provide that workforce. So I think that to combine those two would be logical,
Okay.
and I have no objection to that.
Right. You and I were the lead sponsors on that, and I would agree with you. I'll follow your lead on that. The comments, just
No,
go ahead and just chat, because I saw Senator Terenzini say yes. Okay, Senator Hardy.
Wait, Ann, I'm sorry, Senator Cummings, I didn't want to.
No, that's fine.
Okay. I think we should combine them too, because I think that having the certification for the workforce go along with the programming is helpful. My only request, which is, I will admit, a selfish one, is that I wanted to be on S195 because that was the one that I co-sponsored. But so if you'll indulge me on that, I would appreciate it, but understood. They're Cheryl's bills, or Senator Hooker's bills, so I defer to her.
I think, certainly your concern, we want to have step down beds wherever, all over the state. And
Yes,
sure
for
that,
everybody. We all need them, right?
Work on it, right?
Addison County comes first in the alphabet, so
The
don't
alphabet,
forget us.
yeah.
All right. So, yes, and one concern I think that has kind of shown up today is we've heard about a lot of different certification programs that exist, and so we'll invite Lauren Hibbert in to talk about those different certification programs and how they all sort of fit in with one another. And Katie, can you? Is that something I'm going to ask you if that's something that you would like to do, or shall I follow through? Because I do intend to talk with Lauren, but if it fits in with better with the whole coordination of the bill, I'm open.
I think it's fine if you want to touch base with her first, and then once you know what you want to do and exactly where you want that to go, then you can give that.
Let's do it that way. I'll touch base with her, and then we'll have her come into committee. Aaron will find a window of time. I'm not sure it's going to be on Tuesday, just because of how our committee functions on Tuesday with the floor coming first. So we'll find a time to have her in and talk about just that certification piece. And I may at the same time on 197, we'll be talking about that, and may reach out to Emily Hawes and Allison Crumpf at DMH about that as well. So, any other little ends that we need to tie up with this one? I think those are kind of the decisions we need to make today. Senator Hardy. All right.
That's okay. Just a question. So if Katie is combining the two bills, could you, there were some that parts of one of the bills, and we went over them a while ago, that were confusing to me, the sort of order of how things worked. So
Yes.
I mean, obviously we're going to walk through them and mark them up and all that
Yeah.
stuff, but could you just send them to us so ahead of time, so once you combine it, so that I can read through it to make sure I can remember what was confusing to me.
Was this the piece, this was the piece on the centers, and there were 3 different entities, and one entity was kind of creating the program and one was doing the training and the other was sort of administering the program. Is that?
Yeah, there was that. And then there was a pilot. And
Oh,
seemed
right.
like
The
pilot
community,
was
that
happening
community
this
center
December.
pilot, right?
So
Yeah.
that was really confusing to me. And I don't have the bills up right now, but I just want to make sure that the steps are all working together correctly. And yeah, I mean, we'll go over the bills. I just wanted a chance to read it before so I can remember what my confusion was. So I
Yeah,
can
so
confuse
That's
myself.
that's a good suggestion. So if we can get it ahead of time, we're going to do final markup next Friday. I think it's on the agenda. So that gives Katie sufficient time and us sufficient time, hopefully, to go through it. Yeah,
And
that'd
I
be good.
think just with regard to the pilot, I think kind of that continuity of care that, talking about both in physical and mental health, to make sure that the centers, the community centers and the respite beds centers are working together. So, I think it makes logical sense. It's just, how do you fit it in with everything that we're trying to do?
Yeah, and I think I may have been confused about the difference between the respite centers and the community centers. And
It's the 2 community centers,
already exist in
right?
Right.
One's in Barry and one's in
Burlington.
Burlington. Oh, of
Okay.
course. Yeah. Okay. Nothing in Addison County.
I know. Then see,
Yeah.
this is the problem.
Well,
Addison County has to be first. Anyway, okay, yeah, just so we can clear up that confusion, and maybe it will make sense the next time I read it, but baby.
Oh,
I did not know what you were talking about. He was behind the screen. That's terrific.
Growing up, Senator.
Listen, everybody brings their pets up, but okay. So Katie, we'll do that, and then you will ask on 206. Ruth, are we ready to look at 206? Will we have that next week? We want to get that marked up and out.
Yeah, so that one has become more confusing than it should be. 'Cause
Yes, I know.
there are like 4 plans already, and so
Mhm.
Katie and I are deep into trying to figure out what plan does what and who does which plan. So we are hopefully sorting it out with the
Okay.
players and the planners, and we'll have a bill. I think it's also on Friday for
It
markup.
is. And again, if we could get that one ahead of time, that would be great.
Absolutely.
Yeah.
I think we should be able to send it to you. The plan on the plans. We could send it to you maybe Wednesday morning after we meet with the Dale and VDH and the Alzheimer's Association folks to make sure they're all
Terrific.
okay.
That's terrific. Okay.
Thanks for your patience.
Whenever, Katie, if you can get it to us a day before, that'd be great. And then the question about the letter, which is a great idea in terms of expanding SNAP benefits.
Square.
Rosa is going to work on that one, right?
Yeah, that was a good idea.
Yeah, good. Awesome. All right. Anything else on this
Yeah.
stuff?
I got a question for you, Senator Lance.
Sure. Yeah.
What's it look like for us working on the ALS bill again? When do you plan on that happening?
Oh, we're doing that Wednesday.
Wednesday.
If you look at next week's agenda, which is posted, you'll see that it is Wednesday, and we've got a full slate of folks testifying. If you have family members or others who wish to testify on that bill, let me know. I've heard from people all over the state who support it, but I haven't. And when I've reached out to get folks to testify, they've been less forthcoming. So, but we do have one person with a family member who was affected by ALS, so we'll have her in. Okay. All right. Anything else? Anything else? Nothing else? Wow.
Oh, well, I actually have a question, of course. Except for Cheryl, did you have something? You should go first.
I'm just looking at the Medicare expansion enrollment period and what we're going to do with that.
We'll look at that. Well, I think that's going to happen. Is that in one of our bills?
Yes.
Yeah. We have 239. I know that you're very interested in. I'm trying to remember which bill it's in. And we have some prescription drug stuff to look at. We have a lot of stuff to do. So I'm trying to finish the bills that we've been working on. Then we're going to try to find some concentrated time on S285, because that's a big one. And the primary care, and maybe there's a way we can put primary care, some of the primary care pieces together with 285 or not. And then we have our prescription drug interests, and we'll definitely going to be working on that.
And it is S239. That's the enrollment in Medicare.
That's what I thought. Yeah.
Is
So
that the Medicare
managed care,
Advantage plan?
managed care.
The supplemental insurance. Yeah. that you
Right.
can
Yeah,
enroll
we should
in
do that.
as an open enrollment. Yeah.
The other, so given what we heard yesterday from Green Mountain Care Board and also from Donna Kinzer, I'm really interested in moving forward with something in that realm with the hospital sustainability plan. Is that something?
That's part of 285 and
285. Okay.
and just
I
to let you
wanna
know,
make sure-
I did indicate earlier that I have met with Nolan and Jen on the bill, trying to put together some language that we can begin to look at. We're still gathering information. We're still in the testimony stage, but I think we're ready to start. I'd like to bring Josh Slen back in to talk a little bit about what he heard relative to Blueprint, because I think he may have a slightly different take on some of it or additional information. And then I think then we're just going to start. I will continue my work with Jen, and then we'll just try to put something together. That bill, if we're global budgeting, for me is just so important. And it's been important for a long time, so that becomes a priority, and that's part of the Kinzer report, but also the expansion of Blueprint and somehow systemic changes to Blueprint and MNG. We may want to put something in there. It's policy, not exact, what to do. We're not the ones to say what to do, but perhaps there's some guidance we can offer. So we'll think about that. Those are all good suggestions. And Katie, anything else? We're good.
No, for me, no. Thank you.
All right. Yes, we have a lot to do. And the ALS bill, we will take up Senator Terenzini on Wednesday. The issue will be, the cost for a registry is not significant. Is that the place to start? And we'll have to listen to the testimony from the folks who are coming in. And we do have a member of CDC coming in to talk with us about the national registry and how it works. So we'll get that. All right. Anything else? All right. As I indicated earlier today, we may be getting a bill from Judiciary after they've had a minute to work on it, on substance use disorder stuff. And it's going to be somewhat of a heavy lift. So I'm trying to figure out how to handle that and what the timing will be, because we have so much already that we're doing. So I'll be having a conversation with Senator Sears and with the pro tem about how we're going to deal with that bill. And then we'll be looking at what's coming to us from the House relative to substance use disorder. So
I'm sorry,
just to let you
Madam-
know.
I'm sorry, Madam Chair. What bill did you say about with Senator Sears and the pro tem?
There's a bill that may be coming to us from judiciary, and we may be looking at it. So just a heads up. So what my goal is for us to work, as effectively and efficiently as we can, so we can get everything done. Right. So we'll do that. Okay, Erin, I think we can go off YouTube.